Child and unconscious choking practice. Scene is safe. Gently lower the patient to the ground. Now, if it was an adult, you gently lower them to the ground. Activate EMS. Begin CPR immediately if they are unconscious. Okay? This is unconscious choking. So most people who are choking will go unconscious within 3 minutes. Never perform a blind finger sweep. If you give one breath and you're unable to see the patient's chest rise, you repeat the head tilt, chin lift, you give another breath. If you are still unable to make the patient's chest rise, you go back to giving 30 compressions and try again to do the 2 breaths. Repeat cycles of 30 compressions, 2 breaths until you are able to get breaths in. The patient breathes or the EMS arrives and takes over. Okay? So what you're doing is you're actually pushing the obstruction out of the throat. And then when you're breathing in, you're pushing it back this way. So what you're doing is you're pushing it back and forth, trying to take and get that piece either down into the lung or up out of the lung or out of the breathing. So work with the CPR manager. Practice the steps for child CPR now. Ensure the scene is safe. Check responsiveness. Tap and shout. If the child is responsive, ask if he needs help. If the child is unresponsive, you shout for help. Alert nearby people to come and help. Quickly open the airway. Check for breathing. If the child is breathing, you check the circulation and place him in recovery position if you don't think he has a neck or back injury. If the child is not breathing or gasping position him on his back on a firm, flat surface and quickly remove the clothing out of the way. And when I say remove clothing out of the way, that's just around the neck, okay? Because if you're going to start doing CPR, then you can open up the chest to get ready for the AED if there's one around. All right? And now with a child, you're going to use one hand. And I prefer this hand, to tell you the truth. And it's only one hand, okay? And you're going to be 100 to 220 compressions per minute. You're going to lock your elbow like you do with the adult, okay? And then back to 2 breaths, okay? So that's the only difference between the adult and child CPR is that you're going to be using one hand. So keep your elbows straight and you're going to push down 1/3 to 1/2 the depth of the chest, about 5 centimeters. With the adult, you want to do at least 5 centimeters, okay, or 2 inches, at a rate between 100 and 120. Avoid excessive compression depths greater than 6 centimeters though. After each compression, you allow yourself to come completely up off. You don't come off the chest, but make sure the chest comes back completely to the starting position. And make sure your hands are still in contact. Count each compressions. Count out 30 compressions. Important. Push hard, push fast. Because when CPR fails, most often it is because the person is not pushing hard or pushing fast enough. So give 2 breaths, pinch the child's nose just like you would with an adult, and breathe in the mouth. Take a normal breath, cover the child's mouth with your mouth, give 2 breaths over 1 second. Give just enough air to make the chest start to rise. Try not to interrupt compressions for more than 10 seconds. Use the AED as soon as it's available. Turn it on. If the AED indicates a shock, then you make sure no one is touching again, and you shock. Immediately resume CPR after the shock is given. Continue providing cycles of 30 compressions, 2 breaths, and the child attempts to move, breathe, or speak. Or you are too exhausted to continue, it is unsafe to continue, or EMS arrives. All right? So let's take a few minutes here and practice your child CPR. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 3, 4, 5, 6, 7, 8, 9, 30. And head tilt, chin lift. And 1 and 2, 3, 4, 5, okay? And so that is CPR. And then your AED, considerations of use of children. Use the AED as the same for an adult, except you should look for a child key. Use the child pads if available. So, compression only CPR. While standard CPR compressions with rescue breaths is most effective, compression only CPR is much better than no CPR at all. If you are unwilling or unable to provide rescue breaths, provide the CPR only. Now, if a patient is pregnant, it's a good idea to put a roll underneath the right hip. What this does is takes the baby off of the back and helps the heart pump. Okay, now if the patient throws up or vomits, what you're going to do is place your hand over the head, under the head, and bring the arm like this over, let them vomit, and then back again. Okay? Special considerations, pacemakers. If a patient has a pacemaker, you don't put the AED pad directly over the implanted device. You put it at least 1 inch away. Most times though, the AED is over on the left shoulder. It's not on the right shoulder where you're putting the AED. Now, if the patient has a medicine patch on the chest, you don't put the AED pad over top of the medicine patch. You use protective gloves, remove the patch, then wipe the area clean. Then you'd put the AED pad over top of it. And like I said, with excessive hairy chest, if necessary, quickly shave the area. The hair may also be removed by using a second set of AED pads. Special considerations too. Patient is lying in water. Quickly move them to a dry area and dry the chest. That's why you have a towel in there. If they're lying in snow, you can still use the AED. And if they're sweaty, quickly dry chest with the towel. Pregnant women, it's okay to use the AED. Jewelry on the patient, move it away from the chest. Now, if you were doing CPR or using the AED on me, all you would do is just take this necklace, put it to the back, and then it's clear enough. Definition of choking is when a patient's airway is partially or completely blocked with food or foreign objects so air is unable to get into their lungs. Signs and symptoms of mild coughs, loudly, are able to make sounds and squeaks, wheezing, red face, eyes watery, hands are grabbing the throat. This is called the universal choking sign. All right. Signs and symptoms of severe choking: weak or no cough, unable to make a sound or speak, high-pitched wheeze, blue or gray-colored face, eyes show fear, hands are grabbing at the throat. So, ensure the scene is safe. Ask the patient, are you choking? Sir, are you choking? Are you choking? My name's Debbie, I can help you. I know CPR. And verbalize each step so the patient is aware of what's going on. I'm going to come behind you, and I'm going to do, it used to be called the Heimlich maneuver, but now it's called the chest thrust. Hand over fist, and you just below the breast, and 3, 4, 5, okay? And then you can do backwards. But you're going to take and tell them what you're doing, okay? So you can see her here, she's giving him slightly to the side to support the patient's upper body with your arm and behind him, okay? And this is the abdominal thrust. This is where you come underneath the waist, hand over fist, just following the hip bones around. So you're following the hip bone, hip bones here, following around underneath the belly button, or just at the belly button, and you're gonna go up. Okay? 5 firm back blows between the shoulder blades. Okay? That's your back blows. And then if the obstruction is not removed, proceed to abdominal thrust. Move behind the patient and place 1 foot between his feet for good support. Make a fist with thumbs out and place the thumb side with your fist above the patient's belly button. Okay, just above the belly button. Wrap your other hand on top of your fist and pull up and forcefully. Now you don't want to go too high, so that's why I said right around the belly button, just above the belly button. Now if you're short like me, it's no problem, but a lot of people who are tall tend to slide up a little bit, so that's why I always say right around the belly button. If the obstruction is not removed, alternate the back blows with the abdominal thrusts until the obstruction is removed. If the obstruction is removed, you just monitor the patient's ABCs and reassure. Have him see a medical doctor. If the patient is able to cough or speak, encourage forceful coughing until airway is clear. Okay? Now, in doing obstructed airway with a child and that, you're going to do back blows and chest thrusts as well, but you're going to get down to their level. Now, in saying that, when you take the piece out, make sure you take the child to the hospital and take the little piece with you, because what happens is that you might have some bruising, because doing back blows and chest thrusts on a child, they can bruise easily. So you want to make sure you take it so that they don't think that you've had child abuse. All right? So this is performing back blows with a child. You've got your knee out here for support. Back blows just in between the shoulder blades. Okay, 5 back blows. And abdominal thrusts, you're doing that the same way as you would with the adult. Okay, and like I said, make sure you take the object that they choked on with you. Now, if you're alone and you're choking, these chairs are good for that. Do your own chest thrust or abdominal thrust. Okay? Now, with a patient who is obese or they're pregnant, doesn't mean that everybody who is pregnant is obese, but it just means that you don't want to go over their belly. You're going to go under the arms, hands over fist, and upwards. It's called the chest thrust. But it's also called abdominal thrusts on larger pregnant, if you will need to perform. Okay? So, instead of performing abdominal thrusts on larger pregnant patients, you will need to do chest thrusts. Myself, I like chest thrusts better than abdominal thrusts because it's easier. Give 5 chest thrusts, 5 back blows until the object is removed or the patient becomes unconscious. Now you can see here that you can do it around a patient, but if they're overweight or obese, it's really hard to get around the chair and the patient's belly. So you might want to do it from the front, like this. You can see here how the positioning is still the same, and you're pushing. The only thing you're going to remember though here is that get your head away from the front of their face, because when they cough it out, they're going to give you a black eye. So, give chest thrust until the foreign object is removed. If the patient becomes unconscious, you get them to lie down on the ground and activate the EMS, and you begin CPR. And this is the same thing as an infant, child, or adult, is that as soon as they go unconscious, when they have an airway obstruction, you go into CPR mode. Definition of cardiovascular disease is the system which includes the heart, blood vessels, and the system of blood vessels, that's the veins and arteries throughout the body and within the brain. And this could be any disease or disorder. So some of the risk factors that are controllable for adults is high blood pressure, high cholesterol, diabetes, overweight, excessive alcohol, physical inactivity, smoking, and stress. Women, especially if you're on birth control pills, and you have high blood pressure and you smoke, you're waiting for a heart attack to happen, okay? Risk factors that are uncontrollable is age. As you get older, you tend to have more heart attacks. Men tend to have more heart attacks than women. Family history, if you have a history of heart attacks and strokes, chances of you having one. And ethnicity. Now, people who are Aboriginal descent tend to have high cholesterol. People who are African descent tend to have more high cholesterol as well and more heart attacks than white people. This doesn't, it's just been proven, okay? History of stroke. If you have a history of stroke or you have a history of stroke in your family, or TIA, which is a transient ischemic attack, then you have a higher history or higher chance of having a stroke. History of heart attack, if you have a history of it, your chances of having another one is pretty common. Okay? So definition of a heart attack: when your blood supply to the heart muscle is slowed or stopped because of a blockage. Definition of angina, though, is just when it's temporary slowed, causing a decreased amount of oxygen going to the heart, and the heart just saying, hey, I need oxygen, okay? This is due to a narrowing of the blood vessels of the heart. Signs and symptoms: chest pain, pressure, squeezing, heaviness that can radiate to the neck, jaw, or even teeth, shortness of breath, sweating, cold, clammy, nausea, to the point of vomiting actually, lightheadedness, denial. Denial, denial, denial. Everybody doesn't like the idea of saying, hey, I think I'm having a heart attack. They want to deny it. It's stomach cramps. It's my stomach's upset. But don't believe them. Note, signs and symptoms of angina will usually be relieved by rest, by taking their medication. Women, the elderly, and persons with diabetes may have different signs and symptoms. Quite often, women will have pain in between their shoulder blades rather than in their chest. Okay, what you're going to do, scene survey. Make sure that everything is safe for you. So that's primary survey. Anything that is life-threatening is primary survey. So if you think they're going to have a heart attack, that is life-threatening. So you've got to activate the EMS. Position the patient in a comfortable position, like that's sitting on the floor, and treat for shock. If needed, you assist them to take their medication. Quite often, the medication will be nitroglycerin or aspirin. Quite often, they say that aspirin, if you take an aspirin, like a 350 milligram aspirin or 280 milligram aspirins, as you're going to the hospital, will take and relieve the chances of you actually having a real heart attack. Continue to monitor ABCs. If the patient becomes unconscious and stops breathing, it's only gasping, start CPR. Nitroglycerin, it should take nitroglycerin if they have taken any medications for erectile dysfunction. That's Viagra, Levotrel, Cialis with the last 24 hours, okay? So some of these old guys, they go and they take their Viagra or whatever it is. If you give them nitroglycerin, that opens their blood vessels up even more, and so then what happens is that their blood pressure plummets to the point that they die. Okay? So in the event that there is no relief, nitroglycerin may be repeated every 5 to 10 minutes up to a maximum of 3 doses. Now when I say 3 doses, by the time you're giving them the third dose, you should be on your way to the hospital. Okay? So give them 1 nitroglycerin, 5 minutes later, another nitroglycerin, thinking about, okay, how are we going to get this patient to the hospital? All right? So by the time they have the second one, they should be feeling relief, if not total relief. All right? Aspirin or ASA, the patient should not take ASA if they have an allergy or have asthma, recent bleeding, or signs and symptoms of a stroke. If none of the above is present, if they chew one 325 milligrams or two 80 milligram ASA tablets. This is ASA. It doesn't mean that it's Tylenol. Tylenol is not ASA. All right. Definition of a stroke: when blood stops flowing to any part of your brain. On the part of the brain that was damaged and the amount of damage done. Definition of a TIA, which is a transient ischemic attack. It's a temporary interruption of blood flow to the brain. It's also called a mini stroke. Signs and symptoms of stroke or TIA: if the face is drooping, especially on one side. Arms: if you can't raise both arms, it could be that they're having a stroke. Now, it could be that, okay, I have arthritis in this arm, so I can't raise it very high, and it's something that's not new. Speech: if it's slurred or jumbled, not just having trout mumble, but it's actually having slurred speech, or it could be that, okay, I'm calling this a pencil. Okay? Time: it's time to call 911 right away if you have any of those symptoms. So, if you think that someone's having a stroke or heart attack, scene safety is important. Primary survey and acting fast in your assessment is very important. Using the FAST, okay, the face and the arms and all that, using that acronym that we have back here, FAST. The FAST assessment reveals any signs and symptoms of stroke. Activate EMS immediately and get an AED. Place patient in the most comfortable position. Continue to monitor ABCs. If the patient becomes unconscious, place him in recovery position. And with a weak responsive side down. Okay? So if I'm having a weak and unresponsive side here, you're going to put that down on the ground. Please begin CPR and use AED if breathing stops. So that's why you have to keep tabs of their airway. That's called ABCs: airway, breathing, and circulation. Okay, any questions? So what you should know with this video is that you can pause it at any time and practice any one of the procedures that I've showed you. And I really strongly suggest practicing, because then what happens is that if a child or an adult starts having airway obstruction, then you know what to do and it comes automatic. All right? I thank you very much for listening to me and carrying on, and I hope that you never have to use it.